How's it going, guys? So we have this 41-year-old woman with long-standing dermatomyositis. She was commenced on prednisone therapy 2 weeks ago for an acute disease flare-up. It's her third course of the prednisone the past 18 months. She currently feels well, taking no other medications. She takes an oral daily multivitamin. Non-smoker, non-drinker, BMI 24, vitals normal, and physical exam shows mechanics hands and Gotrin papules, which are characteristic of dermatomyositis. Question wants to know the most appropriate pharmacologic therapy for this patient. Choice A, calcitonin, wrong fucking answer. I've never seen this as a correct answer on any NBME material for pharmacologic therapy that's given. Okay, I'm not talking about Qbank right now. So for 2CK, when we treat hypercalcemia, they want normal saline first, 0.9% NaCl. If they tell you in the last line that's already given, the next answer they want is pamidronate, okay, bisphosphonate for the treatment of hypercalcemia. I've seen calcitonin as a wrong answer. Some students have asked about it, have said it shows up in Qbank sometimes, not on USMLE. Okay, so they want saline followed by bisphosphonate for treatment of hypercalcemia. Now, calcitonin is a very high-yield hormone overall that it inhibits osteoclast activity, and that serum levels are increased in medullary thyroid carcinoma. Wrong fucking answer. Choice B, cyclic progesterone therapy, very nebulous sounding answer choice, wrong fucking answer. This is one of the ways that 2CK OBGYN forms can simply write the oral contraceptive pill. For example, I've seen this as a correct answer for polycystic ovarian syndrome in a woman who's not trying to get pregnant. So they'll say in addition to weight loss, which the following is recommended for this patient, the answer is cyclic progesterone therapy. Okay, so it's nebulous sounding, as I said. Estrogen and progesterone would be fucking wrong, because when you see this combo written as such, it's referring to HRT. Okay, you could say, well, the combined oral contraceptive pill is estrogen and progesterone together. You're right, but you can have oral contraception that's just progesterone only. So once again, choice B refers to the OCP. Choice C refers to HRT. Now, you should know for 2CK that the only approved indication for HRT is severe vasomotor symptoms. Okay, hot flashes for menopause, even urge incontinence. It's not indicated to preserve bone density. There's two reasons why HRT is not given traditionally for postmenopausal women. Number one, it increases the risk of breast cancer. And number two, it increases the risk of thrombotic disorders, DVT, stroke, MI. This is because estrogen upregulates fibrinogen in factors 5 and 8. Okay, so there's no increased risk of endometrial carcinoma when you have the progesterone there with the estrogen. There's increased risk of breast cancer because of the increased absolute amount of estrogen the female is exposed to postmenopausal. Wrong fucking answer. Choice D, raloxifene, wrong fucking answer. Selective estrogen receptor modulator can be used in some postmenopausal women for estrogen-positive receptor breast cancer, okay? And it does not increase the risk of endometrial cancer in contrast to tamoxifen, okay? Tamoxifen is a partial agonist to endometrium, increase the risk of endometrial cancer. Raloxifene doesn't increase the risk of endometrial cancer. So you can know that the SERMs, both tamoxifen and raloxifene, they can help preserve bone density. Once again, they're not used for that indication, but raloxifene is safe on the endometrium. Wrong fucking answer. Choice E, zoledronate or zoledronic acid, correct answer. It's a bisphosphonate. It's the only one listed here. So this isn't me trying to be creative. One of the NBMEs for 2CK does this. Now, if you're studying for step 1, relax, okay? This is still important knowledge for you to know. And what I mean by that is corticosteroids increase the risk of osteoporosis. You have a patient here who's received third course of prednisone the past 18 months. So for step 1, you still have to know glucocorticoids cause osteoporosis, whether it's exogenous or whether it's endogenous causes of Cushing. But for 2CK, you need to know that patients who are receiving multiple courses of oral prednisone, that they traditionally are given a bisphosphonate in that moment. There's a 2CK question where the answer is alendronate now. Alendronate, they're not going to play games with it where they list multiple bisphosphonates. They're not going to do that. Alendronate tends to be the one that's given to prevent osteoporosis / to treat osteoporosis. It's used more for longer term management. Pumidronate tends to be used, I've seen that as a correct answer acutely for hypercalcemia. So I was saying before, normal saline followed by bisphosphonate. Pumidronate tends to be the one that shows up for that, more acute settings, also used for hypercalcemic crisis of malignancy. So zoledronic acid can be used for both. The point of this question is you eliminate to get there. You say, well, all the other answers are fucking wrong. And this patient could use a bisphosphonate because she's on multiple courses of corticosteroid. You should also know, and this is for step 1 level, that bisphosphonates inhibit osteoclast activity. Same mechanism as calcitonin. They both inhibit osteoclast activity. You need to know that. For 2CK family medicine, you need to know bisphosphonates can cause pill-induced esophagitis. Okay, you need to remain upright for at least a half an hour, drink lots of water with oral bisphosphonate. Zoledronic acid, coincidentally, is actually an injection, okay, usually once a year. But I'm saying in general, for at least oral bisphosphonates, pill-induced esophagitis, students like to memorize weird stuff like osteonecrosis of the jaw, exceedingly low yield. I think it actually shows up only once in history across all the NBME forms, steps 1 and 2 combined. Correct answer. You know the deal. I'm just going to make more content. I feel like my stuff's grabbing you. Appreciate your time. That's it.